Now, the number of new infections of the coronavirus has risen to 621 after 14 more patients tested positive for the disease, a decline by nearly half of the cases confirmed on Thursday. Now, the new cases have been confirmed from some 922 samples tested in the last 24 hours. Of the 14 new cases, 10 are from Nairobi, 3 from Mombasa and 1 from Machakos County. Well, this brings the numbers of counties affected to 19 after Machakos joined the list. 9 of the new cases are male, while 5 are female. The youngest is an 11-month-old baby and the oldest is 49. 5 more patients have since been discharged, bringing the total number of recoveries to 202. Now, the country has so far tested a total of 29,430 samples for COVID-19. But it is the rising number of infections among the medical staff on the forefront of the war that is now becoming a cause for worry. Up to 6% of the total infections in the country involve medical staff. Zainab Ismail starts us off.
They are the soldiers on the front line of the war against the COVID-19. But unfortunately, in every battle, there are casualties.
34 out of 621 healthcare workers have tested positive. But I want also to reiterate that so far the healthcare workers have done well even when they have tested positive for COVID-19, and we have not had a mortality or a death of a healthcare worker.
In April, the Kenya Union of Clinical Officers threatened to down tools if the national government did not guarantee the safety of medical practitioners fighting COVID-19. They demanded better equipped personal protective equipment for the frontliners.
Remember, healthcare workers are at the forefront in fighting this pandemic, putting them at the greatest risk of contracting the disease.
Recognizing the critical importance of health, mental and emotional needs of our frontline medical doctors, nurses, and other medical professionals, I am today directing the Ministry of Public Service and the Ministry of Health to develop a welfare package to cushion these frontline officers, especially during this challenging time.
But a section of the Healthcare Workers Union have rejected the way in which the Salaries and Remuneration Commission plans to share the 3 billion shillings package. They say the formula used to share the package is discriminating against some of those in the front line fighting the disease. Meanwhile,
the government says it is keeping a very close eye on all the border points across the country, following concerns of people moving in and out of the country through illegal routes amid rising cases of COVID-19 in the country.
Porous borders have always been a challenge, not only in terms of the pandemic, but also in terms of trade and illegal movement of commodities and people. And you know that as a country we enjoy long borders with some of our neighbors. It's impossible for government to be able to monitor every mile of every border. But there are borders that are known, Panya routes are known, and what the government is doing is to beef up security levels so that some of those Panya routes can be closed off.
Of the 14 confirmed cases on Friday, 10 are from Nairobi and include 4 from Kasarani, 2 from Makadara, 1 each from Umoja, South Sea, Dagoretti South, and a quarantine facility. Zainab Ismail, NTV.